Well, tonight we're answering your questions about the coronavirus. WBZ is the only TV station locally with a doctor on staff. It's our Dr. Mallika Marshall, who we just love, does a great job. Doctor, let's get right to the first question. It's from Penny. Penny asks, is it okay to take a walk in the Fellsway with a cousin who lives nearby if we stay 6 feet apart?
So, Penny, let me first say that you may have seen some online chatter about an article that came out saying that people who walk and jog and cycle might be releasing infected respiratory droplets that if you walk behind them or cycle behind them, you might become contaminated with. Let me just say more research needs to be done on that. What I'm generally suggesting is that people only go out for walks and jogs and bike rides with people that they live with, and that when you are out, that you really maintain at least a 6 foot, if not more, distance between you and the people around you.
This is one of those times where it's important to really like the people who live in your home. Another viewer asks, I'm thinking ahead to warmer weather. Is central AC safe to use, and when is it safe to have someone come into the home for maintenance?
So scientists don't think that the virus is easily spread in heating and cooling ducts, but you want to make sure that your system is in good working order. Probably not the best time to come out and have it maintained. If you have an urgent need and you need a technician to come out to the house, try to get them to wear a mask or gloves and make sure you wipe off anything that they might have touched in the house.
So make sure you talk to them ahead of time, too, and just get all that squared away. Carol writes, I know that they want to track where a person has gone and who they've come into contact with, but are they now saying that everyone should get tested, whether they have symptoms or not?
So, Carol, unfortunately, we're not even testing everyone that has symptoms, much less people that don't have symptoms. Now, hopefully that will change in the coming weeks when we're able to ramp up testing, because you're right. We want to know exactly where this virus is so that we can isolate it and that hopefully we can start opening up schools and businesses, but it's going to take some time.
Just need more tests. And Mike asks on Facebook, if hospitals become overwhelmed, which may happen during the expected surge, how will they decide who receives life-saving treatment, doctor, and who doesn't?
Mike, this is a really hard question to answer and a hard thing to think about, but only if there is a shortage of life-saving equipment like ventilators. The public health officials have come up with guidelines that clinicians can use, and it's based on a point scale. So based on how old people are, what their underlying medical problems are, what the likelihood is that they might survive the virus, they are very explicit to say that it does not include factors like your gender, your race, whether you have a disability, whether you have a job, or whether you're homeless. It really is based on medical factors.
We've heard of them making these terrible decisions in Italy, deciding who gets the help, who doesn't. Let's hope it doesn't come to that point here. Dr. Mallika Marshall, as always, we really thank you for your insight. Stay safe and be well. We'll see you soon.
Thanks, David. You too.
Lisa.